iMediSync is a company that provides an integrated AI mental care platform based on EEG, electroencephalogram. We would like to introduce our company's stories and products. iMediSync started at the Institute of Integrative Medicine at Seoul National University College of Medicine in Korea. We believed that the most important thing to heal a disease is not the disease itself, but the life force. So we thought about how to measure the life force and discovered brainwaves, so-called EEG and electrocardiograms. In 2011, we were designated as a center to collect and build EEG data of healthy Koreans through the National Reference Standard Project, thinking that we could define the life force by using the patterns of brainwaves and electrocardiograms of healthy people by gender and age, and the project lasted for 8 years until 2019. We have built the world's first database of healthy people's QEEG by gender and age, using 1289 EEG from healthy Koreans who meet the criteria for healthy people by age, collected over an 8-year period. While many studies have found no differences between races, the differences between men and women are very significant. This graph shows the developmental and aging trend of the alpha rhythm, the most important rhythm in the EEG. It ranges from 8 to 12 Hz in normal people and is stronger in the occipital lobe when eyes are closed. It signifies the speed of information processing between the thalamus and cortex, which produces alpha waves. During development, it reaches 8 Hz at age 4, reaches the average adult frequency of 10 Hz at age 14, and slowly declines after age 40, with a faster rate of deceleration in men. In people with dementia, alpha wave speed decreases to less than 8 Hz or disappears altogether. Since EEG is subject to a lot of noise during the measurement process, it requires very complex signal processing techniques to remove it. To do this, we trained AI to distinguish between EEG signals and noise signals. Using AI to separate the noise from the measured signal leaves us with clean EEG data. Sample EEG of a patient with mild cognitive impairment in his 70s. Using AI denoising, clean data can be created and then compared to the patterns of healthy people by gender and age. This is a mapping pattern of a patient compared to the healthy pattern, which show excessive theta activities. iMediSync performs this process by calibrating the characteristics over 30 types of EEG systems. In addition to the data of healthy normal people by gender and age, iMediSync developed QEEG biomarkers to distinguish between normal people and mild cognitive impairment using more than 20,000 data related to various stages and causes of dementia, and subsequently developed QEEG biomarkers for people with amyloid pathology and QEEG biomarkers for people with both amyloid pathology and Lewy body pathology. What you see here is the structure of this 8-stage classification model. We have divided people with amyloid pathology and people with mixed amyloid and Lewy body pathology into different stages, even if their cognitive function is still normal. And we have divided people with mild cognitive impairment into the same 3 stages like the normal stage, depending on the pathology. And we have divided people with dementia into cases with pure Alzheimer pathology and mixed pathology for a total of 8 stages. For biomarkers that distinguish between stages, the accuracy of distinguishing between normal and patients, MCI dementia, is 90%, and the accuracy of distinguishing between MCI and dementia is 84%. For biomarkers that distinguish pathology, the accuracy of distinguishing normal from patient, normal from AD and AD from mixed, is 81%, 80%, and 80%, respectively. This graph is from the model analysis of the MCI patient in his 70s shown earlier. He was categorized as having prodromal Alzheimer's MCI. To overcome dementia, early detection of mild cognitive impairment is important, so iMediSync developed EEG biomarkers for mild cognitive impairment. However, in reality, EEG tests are not performed until the patient has already developed dementia. In 2020, we started developing a dry device that can make EEG testing easier and everywhere. And in 2021, we developed the first 19-channel dry EEG device, which is currently registered as an FDA medical device. In 2023, we developed a second EEG device that can also measure preschoolers. iMediSync's EEG equipment has added TPBM function to provide neuromodulation optimized for individual EEG patterns after measurement and analysis. TPBM is reported to have many effects on improving cognitive and emotional functions through mitochondria action and entrainment mechanism, and iMediSync's TPBM is characterized by selecting the location and frequency according to the individual's EEG pattern. The PBM clinic at Harvard University has been conducting ongoing PBM research for the past 15 years. In a meta-study on whether TPBM can improve cognitive function in healthy people, TPBM was found to have significant effects in a variety of cognitive domains, including attention, executive function, learning, and memory, and as shown on the right, TPBM reported increases in beta and especially gamma bands. This suggests that TPBM is providing stimulation in a direction that activates the EEG. In clinical trials in Korea and Japan with elderly people complaining of cognitive decline, iMediSync's TPBM technology was applied to confirm that participants with mild cognitive impairment and rarely early dementia recovered cognitive function between 4 and 12 weeks. The figure above shows that 25 participants had their CDR returned to near normal after the 12-week intervention. This study was based on participants recruited by the 2023 NIA project in Korea. Pre-post EEG changes were monitored for participants in the TPBM intervention. Together, we can see a significant decrease in TBR, a well-known EEG biomarker of cognitive decline, in the frontal and temporal lobes. This result shows the pre-post MoCA score changes for a 4-week TPBM intervention for 20 participants at Nara Gakuen University in Japan. As shown in the figure, participants' MoCA scores increased after the intervention, and there are examples of participants with mild cognition or early dementia returning to normal cognitive function. The change in collective delta plus theta/alpha from pre to post participants with a significant decrease in the center lobe. Significant improvements were also observed in DAR and TAR, also centered in the central lobe. iMediSync provides platform services ranging from easy and high-quality EEG measurement to AI automatic analysis and TPBM. iMediSync's early dementia screening and TPBM technology detects cognitive decline due to aging at an early stage, differentiates the cause of the disease, and applies TPBM technology optimized for individual EEG patterns to improve the aging problem of mankind.